Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about feto-uterine relationship, so go ahead, subscribe, and let's get started. Dear students, now we are going to learn about the feto-uterine relationship. Don't worry about the term, it sounds complicated, but it is actually very simple. Feto means fetus or baby, and uterine refers to the uterus. So feto-uterine relationship simply means understanding how the baby is placed inside the mother's uterus and pelvis. Now, when we assess a pregnant woman, especially during labor, we need to know exactly how the baby is positioned. This helps us understand whether labor is likely to progress normally and what care may be needed. To do this, we look at 6 important things. First is lie, which tells us how the baby's body is aligned with the mother's body. Then, we look at presentation, which means the part of the baby that comes towards the birth canal first. Next is the presenting part, which is the exact part that can be felt during examination. We also assess attitude, which refers to the posture of the baby inside the uterus. Normally, the baby keeps its head bent forward and limbs folded close to the body. Then comes position, which tells us the direction in which the presenting part is facing within the mother's pelvis. Finally, we have the denominator, which is a specific landmark on the presenting part that helps us describe the baby's position accurately. So, dear students, whenever you hear the term feto-uterine relationship, just remember that it is all about understanding how the baby is lying, presenting, and positioning itself inside the uterus. These 6 parameters help us get a complete picture of the baby's orientation and are very important for managing labor and delivery safely. Now, let us discuss the first parameter of the feto-uterine relationship, which is called lie. Lie simply refers to the relationship between the long axis of the fetus and the long axis of the mother's uterus. In other words, we are looking at how the baby is aligned inside the uterus. The first and most common type is the longitudinal lie. In this type, the baby's long axis runs parallel to the long axis of the uterus. You can imagine the baby lying straight up and down inside the uterus, which is the normal alignment seen in most pregnancies. In fact, about 99% of babies at term are found in a longitudinal lie. Because of this, it is considered the most favorable and common lie for childbirth. When the baby is in a longitudinal lie, it can lead to either a cephalic presentation, where the head comes first, or a breech presentation, where the buttocks or feet come first. Dear students, let us continue with the other types of fetal lie. We have already discussed the longitudinal lie, which is the normal and most common type. Now let's look at transverse lie and oblique lie. First, transverse lie. In this type, the baby's long axis is perpendicular to the long axis of the uterus. In simple words, instead of lying up and down, the baby lies across the uterus from side to side, almost like sleeping horizontally in a hammock. Because of this position, neither the head nor the buttocks enters the pelvis first. Usually, the shoulder presents at the pelvic inlet, so it is often called a shoulder presentation. This position is abnormal for vaginal delivery and usually requires medical intervention if it persists until labor. Next, we have oblique lie. As the name suggests, the baby lies at an angle inside the uterus. The fetal long axis is neither parallel nor perpendicular to the uterine axis, but lies somewhere in between. You can think of it as a slanting position. This lie is usually unstable, meaning the baby does not remain in this position for long. As pregnancy progresses or labor begins, it often changes either to a longitudinal lie or a transverse lie. So, dear students, to make it easy to remember, in longitudinal lie, the baby is straight up and down. In transverse lie, the baby is lying sideways. And in oblique lie, the baby is lying diagonally. Among these, longitudinal lie is the normal and most common one, while transverse and persistent oblique lies may create difficulties during labor and delivery. Dear students, now let us move on to the second important parameter of the feto-uterine relationship, which is presentation. Presentation refers to the part of the fetus that occupies the lower pole of the uterus and enters the pelvic inlet first. In simple terms, presentation tells us which part of the baby is coming towards the birth canal first during labor. This is very important because the type of presentation can influence the progress and outcome of delivery. One of the major types of presentation is cephalic presentation. As the name suggests, in cephalic presentation, the head of the baby presents first. This is the most common and most favorable presentation for normal vaginal delivery. Within cephalic presentation, the most common variety is vertex presentation. In vertex presentation, the baby's head is fully flexed, meaning the chin is tucked towards the chest. Because of this flexed position, the smallest diameter of the fetal head enters the pelvis, making delivery easier and safer. Dear students, let us continue with the other varieties of cephalic presentation. The type of cephalic presentation depends on how much the baby's head is flexed or extended. The second variety is brow presentation. In this presentation, the baby's head is partially extended. It is actually midway between vertex presentation and face presentation. Because the head is neither fully flexed nor fully extended, the brow or forehead becomes the presenting part. The denominator used here is the frontal eminence, also known as the sinciput. Brow presentation is uncommon and may create difficulties during labor, because a larger diameter of the fetal head tries to pass through the pelvis. Now let's look at face presentation. In this type, the baby's head is completely extended, with the neck stretched backward. As a result, the face becomes the presenting part. The denominator for face presentation is the mentum, which means the chin. During vaginal examination, the examiner may feel facial features such as the mouth, nose, and chin. Face presentation is less common than vertex presentation and requires careful assessment during labor. So, dear students, a simple way to remember this is more flexion leads to vertex presentation, partial extension leads to brow presentation, and complete extension leads to face presentation. The denominator changes accordingly: occiput for vertex, frontal eminence for brow, and mentum or chin for face presentation. Dear students, let us now discuss breech presentation. So far we have learned about cephalic presentation, where the head comes first. In breech presentation, the situation is different because the pelvic end of the baby, that is the buttocks or lower limbs, presents first instead of the head. Breech presentation is important to identify because it may affect the mode of delivery and requires careful monitoring during labor. The denominator used in breech presentation is the sacrum, which is the triangular bone present at the back of the baby's pelvis. We use the sacrum as the reference point when describing the fetal position. There are four main types of breech presentation. The first is complete breech. In this type, the baby's hips and knees are both flexed, so the baby appears to be sitting cross-legged inside the uterus. Both the buttocks and feet are near the pelvic inlet. The second type is frank breech, which is the most common type of breech presentation. Here, the thighs are flexed at the hips, but the legs are extended upwards towards the baby's head. In simple words, the baby's buttocks present first, while the feet are positioned near the face. The third type is footling breech. In this presentation, one or both feet come down below the buttocks and may present first through the birth canal. Because the feet are presenting, there is a higher risk of complications, such as cord prolapse. The fourth type is kneeling breech. In this rare presentation, the baby's knees are flexed and present first. It is not commonly encountered in clinical practice. So, dear students, whenever you hear the term breech presentation, remember that the baby's pelvic end is presenting first, instead of the head. Dear students, let us now look at shoulder presentation. This presentation is usually seen when the baby is in a transverse lie, meaning the baby is lying sideways across the uterus. Because of this position, the shoulder enters the pelvic inlet first, instead of the head or buttocks. This is considered an abnormal presentation and can make normal vaginal delivery difficult. The denominator used in shoulder presentation is the acromion process, which is the bony tip of the baby's shoulder. So, remember this simple connection: transverse lie, shoulder presentation, denominator is acromion process. Dear students, let us now discuss the presenting part. The presenting part is the specific part of the presentation that can be felt through the cervix during a vaginal examination. In simple words, it is the exact part of the baby that the examiner can touch and identify during labor. For example, in vertex presentation, the presenting part is the vertex. In face presentation, the presenting part is the face. In breech presentation, the presenting part is usually the sacrum, and in shoulder presentation, the presenting part is the shoulder. So, dear students, remember that presentation tells us which major part of the baby is coming first, whereas the presenting part is the exact structure that we can feel during vaginal examination. This helps us identify the fetal presentation accurately during labor. Dear students, let us now discuss attitude. Attitude refers to the relationship of the different parts of the fetus to one another. In simple words, it describes the posture of the baby inside the uterus. The normal fetal attitude is called general flexion. This means the baby curls up into a compact position, almost like a folded ball. The head is bent forward with the chin touching the chest. The arms are folded across the chest. The thighs are flexed onto the abdomen, and the legs are flexed at the knees. This flexed posture is considered the most favorable attitude because it presents the smallest fetal diameters to the birth canal, making labor and delivery easier. So, dear students, remember that attitude is all about the baby's posture inside the uterus. The normal attitude is general flexion, where the baby is nicely folded up, helping it pass through the birth canal more easily during labor. Dear students, we have learned that the normal fetal attitude is general flexion. However, sometimes the baby may not maintain this flexed posture. These are called abnormal attitudes. The first abnormal attitude is deflection, where the baby's head is not fully bent towards the chest. As the degree of extension increases, we may see partial extension or even complete extension of the head. When the head is partially extended, it can result in a brow presentation, where the forehead presents first. When the head is completely extended, it leads to a face presentation, where the face becomes the presenting part. So, dear students, remember this simple sequence. Normal flexion leads to vertex presentation, partial extension leads to brow presentation, and complete extension leads to face presentation. The more the head extends backward, the more likely we are to see these abnormal presentations. Dear students, let us now discuss position. Position refers to the relationship of the denominator to the different quadrants of the maternal pelvis. In simple words, once we identify the denominator, we determine which direction it is facing inside the mother's pelvis. The maternal pelvis is divided into 4 quadrants: left anterior, left posterior, and right posterior. We describe the fetal position based on which of these quadrants the denominator is pointing towards. For example, in a vertex presentation, if the occiput is directed towards the left anterior quadrant of the pelvis, the position is called left occipito-anterior, LOA. Similarly, it can be right anterior, left posterior, or right posterior. So, dear students, remember that position tells us the direction in which the denominator is facing within the maternal pelvis. The 4 pelvis quadrants are left anterior, LA, right anterior, RA, left posterior, LP, and right posterior, RP. This helps us accurately describe the orientation of the baby during labor. Dear students, in vertex presentation, the denominator is the occiput. Based on the direction of the occiput in the maternal pelvis, we identify 4 positions: LOA, ROA, LOP, and ROP. LOA, left occipito-anterior, is when the occiput faces the left anterior quadrant. It is the most common and most favorable position for normal delivery. The other positions are ROA, right occipito-anterior, LOP, left occipito-posterior, and ROP, right occipito-posterior. So, dear students, simply remember, LOA is the most common and best position, while ROA, LOP, and ROP are the other possible vertex positions. Dear students, finally, let us discuss the denominator. A denominator is a fixed bony landmark on the presenting part that is used to describe the fetal position. It acts as a reference point when we determine whether the baby is in an anterior, posterior, right, or left position. The denominator varies according to the presentation. In vertex presentation, the denominator is the occiput. In face presentation, it is the mentum, or chin. In brow presentation, it is the frontal eminence, or sinciput. In breech presentation, the denominator is the sacrum, and in shoulder presentation, it is the acromion process. So, dear students, remember that the denominator is simply a reference landmark used to identify and describe the fetal position during labor. It is an important concept because position is always described in relation to the denominator. Dear students, before we conclude, let us understand why the feto-uterine relationship is so important in obstetrics. By assessing the lie, presentation, attitude, position, and denominator, we can understand how the baby is positioned inside the uterus and predict how labor is likely to progress. This assessment helps us identify whether the presentation is normal or abnormal, guides us in deciding the safest mode of delivery, and forms an important part of both antenatal and intrapartum assessment. It also helps us recognize situations that may require obstetric intervention, allowing timely management and better outcomes for both the mother and the baby. So, dear students, understanding the feto-uterine relationship is essential because it helps us assess labor, plan appropriate care, and ensure a safe delivery. That's the end of this video. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.